COVID-19 Impact Assessment for Private Healthcare Sector. With the stipulation of stringent lockdown measures to contain the outbreak of COVID-19 in India, private healthcare sector is witnessing a dual challenge of significant drop in patient footfalls, elective surgeries and international patients, as well as facing the need to continue operations and invest in additional materials, equipment and manpower to ensure preparedness for eventual treatment of COVID patients if required. Given that the private healthcare sector is expected to face a severe financial crisis due to the ongoing COVID-19 outbreak, FICCI collaborated with EY for the following. Estimate and project the operating losses and return on capital employed for the sector over a 1 to 3 month time frame. Determine the likely cash position and time period over which businesses can sustain with such cash levels. Co-develop recommendations on financial measures required in context of the operating losses and weak cash position likely to be faced by the private healthcare sector. Despite greater than 60% share of bed capacity, the private healthcare sector's financial performance was severely constrained even in the pre-COVID state. Private healthcare sector is the bedrock of capacity and capability in India, particularly in higher secondary and tertiary care, constituting greater than 60% of beds at 8.5 lakh to 9 lakh, greater than 60% of inpatients, 80% of doctors, and is also among the country's top 5 employers. Revenue for the private healthcare sector is estimated at Rs 2.4 lakh crores, EBITDA is estimated at Rs 31,000 crores, 13%, and PAT is estimated at Rs 7,000 crores, 3%. The sector's median return on capital employed is 7%, which is lower than cost of capital of 14%, and the median interest coverage ratio is 2 in respect of best-in-class reference of 5 to 6. The sector is also constrained severely in terms of liquidity, with cash balances available to cover up to 19 days of operating costs and government receivables to the tune of 7% to 8% of revenue. Stipulation of lockdown measures has further constrained the financial performance by March end, causing providers to make operational losses. With strict lockdown measures being imposed to contain the outbreak of COVID-19, hospitals are witnessing a drop in both domestic and international patient footfalls and elective surgeries, resulting in occupancy levels to fall to a mere 40% by late March in respect of pre-COVID occupancy levels of 65% to 70%, and is expected to reduce further. Impact on diagnostic labs: a 80% fall in patient visits and revenue. limited options for containing fixed costs due to need for continuing operations coupled with focus on preparedness for eventual treatment of COVID patients, has resulted in EBITDA margins witnessing a sharp fall to a level lower than 40% by end March or early April, with the sharp decline in revenues. If the situation persists, providers will face severe liquidity crisis, with cash balance 33 likely to cover operating losses only for 1 to 2 months. Operating losses are estimated to the tune of rupees 4,500 crores for a month and rupees 13,400 crores for a quarter if revenues are at 50%, occupancy of 35%. Losses are estimated to the tune of rupees 7,300 crores for a month and rupees 21,900 crores for a quarter if revenues are at 30%, occupancy of 20%. For the sector which is already constrained in terms of liquidity, the onset of operating losses will cause cash balances to be completely depleted if the situation persists for a quarter. While bed utilization is low, private hospitals are expected to be super ready to manage any eventuality emerging from this epidemic situation. Hence, opportunity to rationalize fixed costs is very limited, unlike other industry sectors. Increase in costs owing to infection control and PPE have not been factored in the above estimates. The sector is also expected to be lower by 20% to 35% in terms of revenue, compared to financial year 20, and have early single-digit or negative EBITDA in financial year 21. Financial year 21. Return on capital employed for the sector is estimated at -5% to -15%. Short-term operating losses for the diagnostic sector will be to the tune of rupees 200 to 800 crore for a month and rupees 600 to 2,200 crores for a quarter, assuming 50% to 80% decline in revenue. Key recommendations for financial relief to the sector. Liquidity infusion. Short-term interest-free or concessional interest loans to the tune of rupees 14,000 to 24,000 crores to address liquidity gaps for 3 months. Immediate 100% release of dues locked with central and state government authorities. Estimated dues of rupees 1,700 crores. Indirect tax reliefs or exemptions or waivers. Relief to hospital sector. Recoup amount equivalent to ineligible GST credits paid on procurements for a specified period, which is estimated to the tune of rupees 2,000 crores for 3 months. Provide customs duty or GST exemption on essential medicines, consumables and devices for treatment of COVID patients. Waiver of health cess for identified medical devices introduced in Budget 2020. Extension of time for a period of 3 years needs to be provided under the EPCG scheme. Income tax benefits. Nil TDS for financial year 21 and TDS at 5% for financial year 22. Recoup income tax refunds by adjusting taxes payable and tax dues. Statutory liability payments. Deferment of statutory liabilities such as TDS, PF, ESI, GST for a period of 3 to 6 months without interest, late fee and penalty. Fixed cost rebate. Rebate on commercial rate of power for a stipulated period. Estimated power cost for the sector is Rs 7,000 crores. Waiver of fees on license renewal. Waiver of renewal fees for licenses along with option for renewal on self-certification basis to speeden up the process of bed capacity addition.